what I would do was basically if I had to touch it to go like that, I would make sure the time was right, and then I'd be like 1, 2, 3, 4, 5, and then like, oh no, like a bone cracked or something, or I'm itchy, so now I gotta do it again. So 1, 2, 3, 4, 5, and now that's 2 times I did it, but 2 is a bad number, so now I gotta do it 3 times, so 1, 2, 3, 4, 5.
Harlan Kirschenbaum describes just one of the rituals that used to rule his life. For 13 years, he lived with an extreme case of obsessive compulsive disorder, or OCD. It's a chronic psychiatric condition that has 2 main symptoms: obsessions, or intrusive unwanted thoughts that can't be pushed away, and compulsions, often called rituals, which are repetitive behaviors done to reduce anxiety.
My 2 obsessions are death and cancer, so I would come up with all these like crazy rituals. Like if I touched a wire, then I would think my brother would get cancer because of it. And everything morphed, and I got more and more rituals as time went on. And every day it seemed like I was adding a couple. I was housebound and I couldn't do anything for myself anymore.
At the height of his illness, Harlan had more than 100 daily rituals and couldn't touch or look at his family members.
I had thoughts like all the time of just like, you know, driving into a wall or just anything, because I couldn't do it. It just took all my energy out. Like I'd be crying in public, and 30 years old, and I'm sitting there crying because I saw a traffic light, and now I think that I'm gonna give somebody cancer because of it.
Dr. Peggy Richter is head of the Frederick W. Thompson Anxiety Disorder Center at Sunnybrook Health Sciences Center, one of the few specialized centers in Canada dealing with OCD.
There's a threshold at which point we call it a disorder that merits a diagnosis, and that is when the symptoms waste about an hour or more of the day, cause significant distress for the individual, or get in the way of their ability to function.
OCD is extremely common, affecting about 1 in 40 people. And while research is ongoing to fully understand what happens inside the OCD brain, Dr. Richter says it is a treatable condition.
There are 2 major forms of treatment: cognitive behavior therapy, which is a form of talk therapy, and medication, both of which can be very helpful to the illness. So a good starting point is to see one's family doctor and get a referral to a specialized anxiety treatment center if possible.
Both of these approaches worked for Harlan, but because his OCD was so severe, he also underwent an intensive 3-month inpatient program in the U.S. Harlan says treatment gave him his life back. He can now function without rituals and is able to hug his mother again, something he wasn't able to do for 10 years.
And I grabbed her and I gave her such a hug, and it's like all those thoughts, I beat it. I beat it, and she was crying. I was like laughing, but like a crying laugh, and it was incredible after all those years, and it felt so good.
He now urges others to get the help they need.
You got to be fully committed, or else it won't work. And it's scary, and it's a lot of hard work, and there's lots of up and downs. But once you get there, it's just amazing.
With Sunnyview, I'm Monica Mattis.